I was just going to give a quick presentation on a PrEP initiative that we've initiated at Body Positive, which is a community engagement model. I'll just run through those slides really quickly, just so they're in people's minds, and then we'll come together as a panel and talk about telehealth and removing barriers to access. So in terms of community-based PrEP, so what we did was we implemented a product which is called iPrEP, so immediate delivery of same-day PrEP. On the next slide, we did this in conjunction with Sharon Lessing, who's with the School of Public Health at Auckland University of Technology, and with a clinician group that we're working with really closely as well. So we did this because PrEP's been around since 2018, and there was a target of 6,000 people, but as Minister Burrell mentioned, there's only around 2,500 people have taken it up, and it kind of fluctuates between 1,200 and 2,500. And when the initial product was approved, the target of 6,000 was set based on the cost at that time. The cost has since reduced significantly, so it's a lot cheaper, but the uptake hasn't moved in that space. On the next slide, there's a little bit of stigma around PrEP. So that's where people, at the moment, you have to disclose a lot of your risk activities in order to be able to access PrEP, and people aren't confident with that. And as you saw from 10, being able to kind of do that through a form before you get into the discussion with the doctor might make that easier, because we know 50% of men who have sex with men are not out to their GP about their sexuality, so they're never going to have that conversation and access this tool. So that's one of the barriers, and that's a trust and stigma judgment piece, which I think is really important, and that's where the telehealth stuff might help. But the risk screening is also a barrier in that it goes into my medical record, and who else can see that now, right? I'm not, so where's my privacy in that space? So I think that's something that we need to keep mindful of. There's a little bit of projected promiscuity, that if you're on PrEP, then you must be having lots of sex. So there's that barrier as well. That's in the community that we need to do some work, and there's cost and stuff involved with it as well. But these kind of stigmas around PrEP as being for promiscuous gay men, for example, influence provider behavior in that they won't prescribe it because they don't want to encourage that behavior. They might not feel comfortable about it. And there's a negative impact on policy and funding in that it's not made available, even though it's an effective prevention tool for HIV. We're restricting who can access it based on high risk behavior and who meets those criteria. So there's a little bit of judgment around whether you should be able to access PrEP based on that cost benefit, but also based on the assumption that PrEP is only suitable for certain people. So overseas, they've moved to other models where they've rather been eligible for PrEP, it's whether you're suitable for PrEP. And some of that may be mental stuff that you're working through in terms of sex. So on the next slide. So with UNAIDS, they've brought out 2025 targets, which is where 30% of testing and treatment services are delivered by community-led organizations. And this is because there's a lot of trust already in those spaces, and that's a really good way to get people to be confident and supported to engage in services. And that's, we offer testing at our site, and people become there because A, it's free, B, it's really anonymous, and they feel trusted and supported to access a community organization, and they feel confident to have those conversations they may not have with their GP. So, so the idea is that we need to remove barriers and increase accessibility and choice, and that's what all the presentations have been about today, is being able to give people choice to access things that might work best for them. On the next slide, I'm going through these really quickly. You can read the bits I'm skipping. So we have a community-based testing option at our office. AIDS Foundation does the same thing. So drop-in clinic, we don't have any appointments, so anybody can just rock up. So once they've got the courage to get a test, because there's stigma around testing for HIV, once they build up that courage, they can just come and get tested, and they get the results straight away. And they can do other STI testing. And we also do outreach testing at sex on-site venues as well. So that's to get to other people who would never, ever have this conversation about what they're up to, and ensuring that they're engaging in care appropriately. On the next slide. So in terms of, we started iPrEP in May of 2020, not the best time, with lockdowns and things and changing behaviors. But since then, we've done around 872 tests. So with everybody that comes in for a test, we always do an eligibility for PrEP. So we see why they've come in for an HIV test, what they've been up to, whether they are being safe or whether PrEP might be a tool that might be useful for them. And then we also look at the eligibility requirements, which is different. So you might be, for example, women are not eligible for PrEP according to our funding requirements, but PrEP might still be an appropriate solution for them in terms of what their activities are. So they could self-fund in that situation. So we have those conversations, and we always look for, whether it's appropriate, whether they need it, whether the tools are using now are the best things for them, or what can we do. So we had 872 people come through that. 65% were men who had sex with men. On the next slide. So iPrEP is, what it does is we do an immediate assessment, we do a rapid test, and then we provide access to an immediate startup of 10-day pills to get people online with PrEP. So the idea, when we looked, this is a product that came out of New York, Sexual Health. So they were doing this, and what they saw was if people were deferred, so if they had the courage to come in, get tested, and ask about PrEP, and they were sent away, 65% of those people never actually engaged in PrEP because they'd had the courage, they'd been rejected, and then they didn't have the strength, essentially, or motivation to continue to try and access. And so that was one of the challenges. So with this, the way we're doing this is people come in, they have the initial consult, and they can get on PrEP immediately, and then they continue with further testing. On the next slide. So they come into the clinic. What we've done is we're working with a GP clinic, and they've established a standing order so that we can actually move this piece forward, because it's that whole triaging piece. So we've done the training through ASHM, NZ PrEP guidelines, and we're constantly under supervision through the GP clinic, and it's run through the peer testers. On the next slide. This is the process. It gets this is a little bit too small, but so basically we're doing the assessment. We ask lots of questions. If it's appropriate, so if they've, then we'll continue, or what we do first is we refer them to the GP. Always, if that's the preferred approach, they can look after your complete healthcare. If you're confident to have those discussions, go to your GP. You can also go to Sexual Health, or you go to telehealth. If they don't work for you, then we continue the process with us. We have a discussion, see whether it's appropriate. If it is an appropriate solution for you, then we'll do an assessment. If you've had an exposure in the previous 72 hours, you're not eligible, you'll need to go to access PEP. Otherwise, we'll do the testing and provide the 10-day starter pack so people can continue. And what they do then is they get a lab form, and they're connected into our GP clinic, which is doing a telehealth kind of solution, and they're the people that will then do the ongoing support for the person to engage in PrEP. We're basically like a gateway, and that's where that trust piece, I think, is really important, and the engaging community to get people engaged in this process, because the people that come to us for testing probably wouldn't go anywhere else to talk about sexual health or to talk about these things. So it's a good way to engage community as kind of your recruiters or educators or support people out in the community to engage people appropriately to access a service that's appropriate for them, and to just answer all the questions they may have. On the next slide. So this is the people for the people that have gone through the whole conversation, gone to the bottom and done all the kind of pieces, we had 36 people actually engage in iPrEP. So you can see we've had a significant number of Maori access the program, which is great. And Asian, and around 46% are European. And of these, I think the number was 55% had never tried to access before, but 29% had been repeatedly denied access to PrEP through different GPs. And that's for different reasons. The GPs didn't know how to do it, they weren't confident with it, or there was a little bit of judgment around whether it was appropriate for the person. So on the next slide. So we did a clinic at Big Gay Out. AIDS Foundation kindly asked us to come. They do testing at Big Gay Out. And so we were back at the testing station to just have PrEP conversations. So again, we're reaching an audience that has never had that conversation or has struggled. And what we saw there is we saw a number of people that have been denied access. So on the next slide. So we'd had a lot of PrEP conversations. We connected people up to the GPs or to Sexual Health. But we also got about 6 people on PrEP at Big Gay Out. And so some of the comments we got back were it was very difficult to obtain also hesitation from my GP. The GP didn't have enough information. So there's been lots of training in that space, but how do you get all GPs to be aware of PrEP when it's a smaller group, right? And we had a trans man who'd been repeatedly rejected over 2 years in terms of accessing PrEP. And so there's challenges for people. There's also challenges for international students because they're not funded to access PrEP, and there's a high risk there. There's barriers around access, location, and operating hours, which is the telehealth piece, and the self-testing piece will really help in that space. One of the things we do is we courier medications to people's homes, and some people don't want that because they don't want the medications delivered to their home in case other people see them or their partners might see it. So some people get their meds sent to our office. Telehealth would send an electronic script, which would solve that problem, which would be great. And the other problem is district health board boundaries. So if you're outside Auckland, then there's issues around funding and access and all kinds of stuff, but hopefully that'll be resolved next year. Next slide. So in terms of opportunities, we feel that, so we do point of care testing, and everybody that gets a point of care test should have a discussion around risk and the opportunity of PrEP, of whether it's appropriate for them. And ideally, they should be offered to start PrEP immediately if that's what's appropriate for them, to remove that barrier and the risk of them disappearing into the wind, essentially, and not engaging. We need to move away from the funding restrictions that we have now with the eligibility criteria, forcing people to disclose their crystal meth use or their history of anal sex to their doctor is a barrier for people. And these people are probably most at risk because they're not engaging potentially in safe sex. So that assessment is actually causing more risk. So getting rid of those restrictions, I think, is something we really need to look at doing. And getting iPrEP at sex on site venues, I think, will be really good because it gets to a really down low community. So I think engaging communities to know how to access the people in need, I think, is a really good learnings from this project. And looking, I know Pacifica are really low in terms of uptake of PrEP. And so how do we do that? We need to engage Pacifica in that conversation to get them to actually engage if it's needed, right? And just have those conversations so people are safe. So yeah, that's my presentation. So I just wanted to do that just to give that different perspective in terms of the community and the engagement and trust piece of it.